You can run 10 kilometers without any symptoms and feel perfectly fine, while a dangerous blockage is forming inside your body. How is that possible? Because biology doesn't care how fast you run. Your body adapts so well that it can mask blockages up to 90%, keeping blood flowing perfectly until it stops. That's why, for half of men, the first symptom of heart disease isn't pain, it's sudden death. Today, you'll learn why even a healthy heart can weaken, how the body hides these time bombs, and the only way to get your heart checked before it's too late. The heart is a tireless machine, working continuously to pump blood to nourish the entire body. So it requires a lot of oxygen and energy. Importantly, the heart cannot obtain oxygen from the blood it pumps on its own. It relies on the coronary arteries for its own oxygen supply. The coronary arteries surround the heart, silently supplying oxygen to the myocardium, much like the roots that nourish a tree. Within this system, the left coronary artery, and especially the left anterior interventricular branch, called the LAD, plays a vital role because it supplies most of the left ventricle, the chamber responsible for pumping blood throughout the body. If a small branch is blocked, the heart can still adapt. But when the LAD is blocked, the underlying myocardium quickly becomes deprived of oxygen. Heart cells die, and the pumping function collapses in a short time. This is the mechanism of a dangerous myocardial infarction. Modern medicine shows that these blockages often develop silently over many years due to high blood lipids, high blood pressure, blood sugar disorders, smoking, stress, and a sedentary lifestyle. This emphasizes that heart disease does not appear suddenly, but is the result of habits accumulated over time. Let's return to the core question. Why can blood vessel blockages still occur in people who exercise regularly and appear very healthy? To answer logically and scientifically, it's necessary to understand that blood vessels are not simply conduits, but living structures constantly subjected to the effects of time and the internal environment of the body. A healthy artery is highly elastic, capable of expanding and contracting with each heartbeat. Inside the blood vessel is a very thin layer of cells called the endothelium. This layer acts as a smooth surface, allowing blood to flow freely without obstruction. When the endothelium is intact, blood cells and cholesterol have difficulty adhering to the vessel wall. However, over time, this endothelial layer faces numerous damaging factors. High blood pressure creates constant mechanical stress on the blood vessel walls. High blood sugar disrupts the function of endothelial cells. Toxins in cigarette smoke cause inflammation and oxidation. Even in people who exercise intensely for extended periods, the strong and repetitive blood flow can create tiny lesions on the surface of the blood vessel lining. While these lesions may not cause immediate symptoms, they have significant biological effects. When the endothelium is damaged, the body activates a repair mechanism. LDL cholesterol is transported to the site of damage as a temporary patch. Simultaneously, the immune system mobilizes white blood cells to treat the damaged area. During this process, the white blood cells absorb cholesterol and metabolize it into foam cells. If this repair process is repeated over many years, The foam cells will accumulate in increasing numbers. Gradually, along with the deposition of calcium and metabolic products, this mass of cells hardens, forming atherosclerotic plaques inside the artery wall. These plaques narrow the lumen of the vessel and reduce its natural elasticity. This entire process is called atherosclerosis. It's crucial to emphasize that atherosclerosis doesn't develop overnight. It's the result of decades of accumulated damage, inflammation, and metabolic disorders. Therefore, while exercise is important, it cannot fully compensate for other risk factors if they are left unchecked. Understanding this mechanism helps us view cardiovascular disease more realistically and proactively protect our blood vessels early on, before these insidious damages become serious problems. There's a very common misconception, and it's this very misconception that leads many people to be complacent until it's too late. Most of us picture plaque in blood vessels like dirt accumulating in water pipes. The more dirt there is, the narrower the pipe becomes, the weaker the flow, and eventually it will become completely blocked. Based on this idea, many people believe that the body will definitely send early warning signals. They think that when there's a problem with blood vessels, they will feel chest pain, shortness of breath, or noticeable fatigue. This sounds logical, but in reality, human biology doesn't work that way. Blood vessels are not rigid, immutable tubes. They are living structures capable of constant reaction and adaptation. When atherosclerotic plaque begins to form and grow in the artery wall, the body's first response is not to narrow the blood vessel. Instead, the artery wall gradually expands to create more space for the plaque. This mechanism is known in medicine as active remodeling. Thanks to this adaptation process, something seemingly paradoxical happens. A person may have a large amount of atherosclerotic plaque in the walls of their blood vessels, but the lumen of the vessel remains clear and blood flow is normal. The heart still receives enough oxygen, both at rest and during a strenuous activity. That person can still walk briskly, climb stairs, even run 10 kilometers and feel perfectly healthy. There is no chest pain, no shortness of breath, and no signs that would make them suspect an internal problem in their blood vessels. This remarkable adaptability becomes a double-edged sword. It masks the disease for a very long time. While patients feel reassured about their health, atherosclerotic plaques continue to grow and change a structure. Modern cardiovascular studies show that the danger lies not only in the rate of blood vessel narrowing, but also in the nature of the plaque itself. Plaques rich in cholesterol and inflammation, even if they haven't caused significant narrowing, are more prone to rupture. When an atherosclerotic plaque ruptures, the body immediately reacts by forming a blood clot to repair the tear. This very blood clot can suddenly block a blood vessel in just minutes, completely cutting off blood flow to the heart. This is when a heart attack or malignant arrhythmia occurs, and the patient no longer has a chance to feel what is happening beforehand. This is why medical statistics present such a thought-provoking figure. Approximately half of men and nearly 2/3 of women experience the first signs of cardiovascular disease during a serious event, even a sudden death. Prior to that, they lived normal lives and felt healthy until their final moments. So what causes this process? What turns a silent atherosclerotic plaque into a life-threatening event? The answer lies in stability. Remember, these soft atherosclerotic plaques are like blisters covered by a thin layer of skin. If you experience a sudden spike in blood pressure during a strenuous physical activity, extreme stress, or even simply shoveling snow on a cold morning, that thin layer of skin can rupture. That's what plaque rupture is all about. When an atherosclerotic plaque ruptures, the contents spill into the bloodstream like a burst balloon. Your body interprets this as a large open wound and immediately sends platelets to clot the blood. This is exactly what you want if you cut your hand, but it's precisely what you don't want happening inside your coronary arteries. In just minutes, that blood clot grew large enough to completely block the artery. It's not the slow buildup of plaque that obstructs the flow, it's the sudden, rapid formation of the blood clot that acts like a cork in a wine bottle. Blood flow is stopped. This is a type 1 heart attack, and it can happen to anyone with soft plaque, no matter how healthy they look. Besides type 1 myocardial infarction, caused by the rupture of atherosclerotic plaques and the formation of blood clots, medicine has also recognized another, less noticed mechanism, but one particularly relevant to those participating in endurance sports when they push their bodies beyond their adaptive limits. This mechanism is known as type 2 myocardial infarction. Type 2 myocardial infarction does not occur due to a complete blockage of a coronary artery, but rather due to an imbalance between the oxygen demand of the heart muscle and the amount of oxygen supplied to the circulatory system. Simply put, the heart needs more oxygen than the blood can supply at that moment, even though the blood vessels are still functioning. In fact, this can happen in people who appear perfectly healthy. During prolonged or high-intensity exercise, a person may not experience typical chest pain at all. Instead, the signs are often vague and easily overlooked, such as unusual fatigue, rapid loss of energy, dizziness, nausea, or an indescribable feeling of discomfort. Many people mistake these symptoms for dehydration, hypoglycemia, or general exhaustion. During a physical examination, blood tests can detect troponin, a protein found inside heart muscle cells. Troponin only appears in the blood when heart muscle cells are damaged or die, making it an important biomarker for actual heart damage. It's noteworthy that when coronary angiography is performed, these cases often don't show complete blockage. The blood vessels may only be moderately narrowed, still sufficient for blood flow under normal conditions. However, when the heart is overworked for an extended period, oxygen demand skyrockets, while factors such as dehydration, tachycardia, and electrolyte imbalance reduce oxygen supply. When supply fails to meet demand, a sensitive area of the myocardium becomes oxygen deprived and damaged, leading to a type 2 myocardial infarction. This view suggests that myocardial infarction is not always caused by a blockage in a blood vessel. In some individuals, particularly those participating in endurance sports, exceeding the body's adaptive limits can create a dangerous imbalance between the heart's oxygen demand and supply, leading to myocardial damage through a silent but equally serious mechanism. So if you don't feel your heart rate increase, is there any good news? Your heart has a secret backup system called collateral circulation. Imagine your main arteries as highways transporting traffic to the heart muscle. If a blockage persists for years, your heart will become its own city planner and begin building branch roads to bypass the blockage. These small blood vessels, called collateral vessels, grow and expand to create alternative pathways for blood flow. That's why a 70-year-old might survive a heart attack while a 40-year-old dies. The older person's heart has had time to build those alternative pathways. In younger people, the rupture of a blood vessel happens suddenly. The primary pathway is blocked, and there's no other way. The heart muscle dies before the backup pathways can be established. What's one of the best ways to promote the growth of these protective blood vessels? It's Zone 2 training and HIIT. Exercises that build a network of blood vessels give you more time. And time is the only thing that matters when your major arteries suddenly become clogged. But this is where many athletes make a mistake. Your body doesn't differentiate between running a marathon or running away from a tiger. It simply pumps alarm chemicals into your bloodstream. If you overtrain without adequate recovery time, high cortisol levels will cause chronic inflammation of the blood vessels. Your heart is like a dedicated warrior that has worked tirelessly for decades. Don't treat it like a race car that needs to run at full speed every day. Now let's discuss the chemical factors that make up these time bombs, because this goes far beyond the basic story about cholesterol that you usually hear. Your doctor checks your LDL and HDL levels and declares you healthy. But in reality, there are invisible chemical agents that routine blood tests completely miss. First is lipoprotein, or LPA. This is a genetically engineered protein that acts like the trailer hooks I mentioned earlier. You either have high levels of LPA or not, and no diet or exercise can change that. It's like having internal spies constantly damaging your artery walls from the inside. When the lining of an artery is damaged, the body sends white blood cells to repair it. But instead of fixing the problem, these cells often get trapped under the artery wall along with cholesterol and calcium, forming dangerous, soft atherosclerotic plaques. It's like calling in a repair team only to end up burying them right in the foundation they were trying to fix. The second key factor is ApoB, which measures the actual number of cholesterol-carrying particles in the blood, not just the amount of cholesterol itself. You might have normal LDL cholesterol levels, but the number of these particles could be extremely high. It's the difference between having many large trucks versus many small cars carrying the same total cargo. Smaller vehicles cause more traffic congestion and damage blood vessels more. Next is the connection to cortisol. Chronic stress, whether from overtraining, work pressure, or life circumstances, causes cortisol levels to rise. High cortisol levels act like sandpaper on the artery walls, creating tiny cracks where plaque begins to form. This is why people in high-stress jobs have a higher rate of heart attacks regardless of their fitness level. Instead of general advice, I'm going to give you a specific, truly effective procedures. The goal is to find the fire before the house burns down. A routine blood test only tells you the components in your blood. It doesn't tell you whether they're clinging to the walls. you need better data. Your first weapon in your arsenal is the CAC index, a quick test that takes just 5 minutes to assess the amount of calcium buildup. Imagine calcium as scar tissue that forms after years of arterial damage and repair. A score of 0 is perfect. Scores from 1 to 99 indicate mild plaque buildup. 100 to 399 indicate moderate disease that needs attention. Above 400 is a ticking time bomb requiring immediate intervention. But the CAC index only shows you old, hardened atherosclerotic plaques. The most dangerous plaques are those that are soft and do not contain calcium. For these, you need a CT angiography. This method allows you to see soft atherosclerotic plaques, unstable, invisible blisters that have not yet hardened. This is the ultimate early warning system that can detect problems years before you experience symptoms. Don't push yourself to exhaustion in every workout. Aim for 80% of your maximum intensity to reap cardiovascular benefits without triggering an excessive cortisol response that can lead to vascular inflammation. This is the ideal level for building collateral circulation and improving cardiovascular health without causing chronic inflammation that damages arteries. Your heart doesn't need you to prove how strong it is every day. It needs moderate, steady pressure to force it to adapt without causing damage. Think of it like building muscle. You don't lift maximum weight in every workout. You gradually increase the weight while still allowing your body to recover. In the emergency room, we often say time is money. 20 minutes after a complete blockage, irreversible damage begins. 90 minutes later, heart tissue turns into scar tissue, and scar tissue is no longer able to pump blood. That's why recognizing the symptoms is incredibly important. Men often experience a Hollywood-style heart attack, intense chest pain and pain in the left arm. For women, the symptoms are usually more subtle. These may include extreme fatigue, shortness of breath, nausea, or even severe acid reflux. If you suddenly feel unwell, don't ignore it. It's your nervous system detecting something your conscious mind hasn't yet recognized. This is something the fitness industry won't tell you. Do you know what protects your cardiovascular system better than running? It's social connection. Studies like the Rosetto effect show that people who eat fatty pork but live in loving communities have fewer heart attacks than those who follow a solitary, perfect diet. Your heart really needs human connection more than a treadmill. Chronic loneliness creates an inflammatory response similar to smoking a pack of cigarettes a day. So, after watching this video, go outside and hug someone because your cardiovascular system really depends on it. For those who want the most accurate information, don't just look at LDL cholesterol, look at ApoB. This indicator tells you exactly how many atherosclerotic plaques are circulating in the blood. A person who looks very healthy can still have extremely high ApoB levels due to genetic factors, putting them at high risk despite having normal cholesterol levels. Additionally, consider advanced lipid tests including LPA, oxidized D, and inflammatory markers such as high-sensitivity C-reactive protein. These tests reveal the internal chemical environment of your arteries that the standard tests completely miss. Heart attacks, not caused by heart disease, are largely a tragedy of ignorance. The body's incredible ability to adapt and compensate becomes its greatest weakness, as it ignores all warning signs until it's too late. Control blood pressure to prevent mechanical damage to arteries. Control blood sugar to prevent inflammation. Exercise regularly. But don't overexert yourself. Most importantly, don't guess whether you're healthy or not. Use the technology available. Check your CAC. Know your LPA and ApoB levels. Understand what's really happening inside your arteries instead of hoping that feeling healthy means being safe. The difference between a sudden death and a long, healthy life often lies in information. Now you have that information. The question is, what will you do with it?